All right. Welcome, everybody, and happy World Global Oral Health Day. It's great to be with all of you today. My name is Megan Harrison. I'm a research associate and program officer at the Johns Hopkins Center for Global Health. And it's my privilege to welcome you, here to our webinar. We actually did set this one up like a meeting because it was going to be kind of like a casual and interactive session. So please do feel free to introduce yourselves in the chat, maybe drop your LinkedIn and just say where you're coming from, where you're located. I think it's always cool to see where folks are joining from. So I'm here in Baltimore right now. But yeah, really excited about this event. This is really inspired to be sort of a precursor to our in-person event that we're having next week, our Global Oral Health Symposium. For those of you who are going to be joining that in person, we look forward to seeing you there. And if you're not able to join in person, I'll be dropping the link to join via Zoom if you'd like to check it out virtually. So I'll drop that in a moment. But yeah, thank you so much for joining today. I'm going to go ahead and pass this over to Dr. Mehta to just kind of kick us off. He's going to be kind of the MC and leading us today. So over to you, Sujay.
Thank you, Megan, and thank you to the Center for Global Health for organizing all of this. This has been fantastic with fairly short notice. My name is Sujay Mehta. I'm in Vancouver. It's 5 a.m. here. We are going to, and we really wanted to engage as many people and folks that we don't always get to see when we do the noon type of things on the East Coast. So I'm glad to see we've got some familiar and new faces. I am going to introduce our amazing panel, our guests in just a moment, but I'm wondering if Pri is here and if we're going to do our
I
first.
am here. Can you hear me?
Yeah, welcome, Dr. Pri. So Dr. Priyanka is part of Solidarity Dental Foundation and kind of the co-sponsor organizer of this, along with the Hopkins Center for Global Health. And Megan and Pri are going to do kind of back of house type stuff with the tech and Slido. So we have our first question, hopefully, where you can say where you're zooming in from. And if you want to put your city, country, and your time. So I would put Vancouver, Canada, 5 a.m. And Dr. Seymour would say put Boston, Massachusetts, 8 a.m. And Megan would put Baltimore, 8 a.m. And so, yeah, let's see where you are. Dr. Lee, are you in Nairobi or Seoul?
Seoul
I guess Seoul.
now.
Okay, fantastic. And what time is it in Seoul right now?
9 p.m.
9 p.m. So yeah, this works out really well. It is kind of late for you, but this is fantastic that you're here. So let's see if this works.
Yay, I think it's working.
Working, fantastic. All right, so there we go. Fantastic. So now, so we're gonna do a couple of questions like this, so you can keep that Slido thing open, whether it's on your phone or otherwise. I have to get mine. Fantastic. So while that comes up, I'm going to introduce our guests who you all are excited to be here. Thank you for all your engagement on social media and everything. So first up, we have Dr. Brittany Seymour. She is Associate Professor and Associate Dean for Faculty Affairs at Harvard School of Dental Medicine. She's completed executive coaching on positive leadership and the Harvard Learning Center series on leadership effectiveness. She has a certificate in managing happiness from the Harvard Kennedy School Center for Public Leadership, part of the Harvard edX University Learning Initiative. After 5 years in private practice, she transitioned to a full-time academic career in global health and has helped create oral health programs around the world where dental services otherwise were not available. So, for example, her work starting the first dental school in Rwanda, reforming dental training in Vietnam, implementing novel education programs for the World Health Organization regional office for Africa's 47 member states. Back in 2023, she was recognized with an Educator of the Year award and became the first dentist recognized for faculty leadership, also in 2023, by the Consortium of Universities for Global Health at the annual meeting there. And most recently, she's transitioned to the Associate Dean for Faculty Affairs to support the goals and aspirations of her fellow colleagues in their career journeys. Today, she leads career mentorship, development, and professional advancement programs for more than 300 faculty members at Harvard, with a focus on positive team collaboration, leadership, innovation, and impact. And we also have Dr. Haewon Lee. She earned her dental degree from Harvard School of Dental Medicine. She has also earned master's and doctoral degrees in public health from Johns Hopkins School of Public Health. Specializing in maternal health policy and management, she is a board-certified pediatric dentist. Dr. Lee currently is directing the Global Maternal and Child Oral Health Center at Seoul National University. From 2021 to 2024, she chaired the World Federation of Public Health Association's Oral Health Work Group, fostering collaborations among national public health associations to integrate oral health into primary health care. In 2023, WFPHA had launched the Global Maternal and Child Oral Health Initiative with more than 50 endorsements from international and national public health organizations, including ministries of health. Her expertise bridges clinical practice and public policy. As a public health officer at the U.S. Department of Health, she worked with public health experts in developing national oral health programs and guidelines with particular focus on maternal oral health. Recently, she secured a South Korea development grant to strengthen Kenya's primary healthcare workforce capacity in maternal and child oral health promotion. So we have our two hosts. Welcome, both of you. Thank you both for coming and for, spending an hour with us. We'll see how the time goes, but we really wanted to make this as interactive as possible. And first off, kind of with the idea of sitting around a fire, we wanted to maybe share a beverage and maybe spill the tea, so to speak. So as far as professional updates, we're going to start with Dr. Seymour. You've had this very, very interesting, fascinating for some of us, this transition from global health discipline director to leadership position in the dean's office. And I wonder if you could start with just your thoughts as far as how that goes. How do you balance that? Are you able to kind of maintain some things with global health? Tell us.
Sure. Good morning, everybody. Can everyone hear me?
Yes.
Really loving the truly global nature of today. Thanks to everyone for joining and this opportunity to have a conversation. Sure. Happy to discuss a bit about my transition briefly. I've been, I suppose, in the kind of domain of global health for about 15 years. Started to reach a point where, global health has, I recognize global health has evolved, I think in good ways since my earlier career years. Just started to kind of sense it might be time for me to be open to evolving my own career to reflect the evolution of global health. I didn't have any specific plans to transition per se, but rather just opened myself up to that possibility. And as things tend to happen when we open ourselves up, the opportunity arose to transition into this position as Associate Dean for Faculty here at the dental school. I embraced that opportunity, decided to take the leap because when I transitioned from private practice and took the leap into global health, it just expanded my world in ways I never could have imagined. That worked out well for me. So I thought, well, let's see where this goes. I will say it's, it's a different path going into administrative leadership than, kind of an academic position. I do maintain both right now. I think it's important. Also, love my global health career, wasn't ready to walk away fully. So, luckily with the support of the dean and my colleagues, I am continuing to maintain both. I'll say I do draw in my leadership role now from my global health experience every day. Global health taught me patience, resilience, humility, agility, the importance of community engagement. My community now is my HSDM community and primarily my faculty. And global health really taught me the importance of kind of humble leadership, really engaging and empowering the people I am here to serve. So I've translated that skill set that I learned in global health to my new role now, and hoping it'll serve me as well in this role as it did in global health.
That's amazing and promising and exciting, all wrapped up into one. Thank you. That's fantastic. I'm glad, obviously selfishly glad that you're able to balance both, because that I think was the worry for some of us, that we would lose you. But so thank you, and thank you to your dean for figuring that out. Dr. Lee, similar question. You've worked in, these very different environments, Korea, Geneva, Kenya, the US. Interested to hear how to balance all of that and the traveling, because as I kind of questioned, well, where in the world is Dr. Lee, but currently in Seoul?
Good question. Where do I start? I was born in Korea and I grew up in New Zealand. And most of my career life in the United States, my dental school and my first job at the Department of Health as a Commission Corps officer. So that was the first big decision, whether I stay as a clinician or stay full-time in public health. And I asked many people, like, what is the right answer as a recent graduate? And I had a really, really great mentor from Johns Hopkins Bloomberg School. So I started my MPH to explore the world of public health while I was working full-time at the Department of Health as a dental officer. I was managing the healthcare, the health center dental programs. And I was fascinated by how public health work at the population level. So I learned about this in dental school at the population level. So it really gave me a perspective to become a bit different kind of dental clinician, I think. So I pursued my specialty in pediatrics, which I love, that population, mothers and children. And then I think my best decision in career life was to pursue a second doctoral degree at Hopkins, doctorate in health policy and management. I really learned how things work, how we can create enabling system for providers and patients to promote health. So that was my best decision in career life, going back to Hopkins, finishing my doctoral degree when my son was 1, and I finished when he was 5. So talking about balance is right there. And then I was working mostly domestic policy and data analysis. So my main data analysis on CDC's PREMS data, the Pregnant Women's Survey. And I really love to work on the Medicaid dental coverage for pregnant women. So that was my doctoral thesis and analysis and so on. But I always had this soft heart that I learned from Harvard. When Dr. Paul Farmer was there, he was my professor for social medicine. And I really wanted to explore outside the United States, and that opportunity came. So I recently moved to South Korea, Seoul, and 100% of my work is on global oral health, both policy level as well as a program development level. So that's where I am balancing my clinical work in Kenya and my licensing in the States, and also my research on workforce development. How can we use non-dentist workforce, like nurse and midwives and teachers, to really promote primary oral health. So I think as a clinician and researcher and health policy lover, I think that's the balance that I have now in Seoul, South Korea.
Fantastic. Yeah, quite amazing. And really reinforces the importance with those faculty members. I'm just thinking of your comment about Paul Farmer, just having those inspiring faculty to really kind of push things and excite you from different perspectives and how they can change your career trajectory completely. So fantastic. Thank you. We're going to ask you all in Zoom land another question. What word comes to mind with oral health? And we're going to put a little reference here from Dr. Seymour as far as the definition. But yeah, I think that's going to be, if the Slido comes up, let's see. And as we get that coming up, we can chat a little bit about not only the definition, but advice that now you both have, Dr. Seymour, Dr. Lee, for students and professionals interested in getting involved in global health. And I'm gonna kind of open this up to both of you. We don't necessarily have to go in any order, but either one of you want to take that on first. We'll talk about students and professionals and then the organizations and kind of projects and pathways that people should contribute. So I'll let you kind of take whichever one or both.
Sure, I'm happy to start. I think my advice for those who are pursuing this path or considering pursuing this path is go for it. It has created a career for me. I think back when I was, dental student, this is not what I envisioned I would be doing day to day, month to month, year to year when I was in my training program. And so I say global health gave me a career I never imagined. It's exceeded all expectations I would have set for myself. And for that, I'm grateful. It speaks to the people in this field and the opportunities it provides us. So do it, go for it. But think of it as a specialty in and of itself. Consider additional training, consider, and not just so that you can develop the competencies and skill sets to do the work, because there are, skill sets that really help us be successful in the field, but also to build those connections, identify those mentors, learn from the greats, to really continue to build and grow this field.
For those who consider global oral health, I highly recommend to tap into the world of global health with different sources. My mentor and friend, Richard Skolnick, who is the author of the Global Health 101 textbook, beautifully described how we can explain global health in so many different lenses. So I think it will be really beneficial to first learn and have a deep understanding of global health and different aspects of it. And then global oral health. I think it'll be great to follow up WHO's amazing momentum, the officers posting on LinkedIn and all that, to learn about the current momentum about oral health, the workforce issue, the definition of essential primary healthcare and all those. But I also understand that when I talk to like 100 students, maybe 2 or 3 sign up for the next step for global health and global oral health. So with that understanding, this is not for the majority or everyone, but it's a definitely fascinating area to tap on, even for mid-career professionals. It's amazing career to add on to your clinical services, your administration, and your other work. There's always things to add to the global oral health from the different perspective. There are a couple of sources that actually you can feel the landscape of global health. Global Health Now is an amazing newsletter platform run by Johns Hopkins School of Public Health. You can see how things are happening and handled across the globe in a public health perspective. So I think those are great materials to learn from. And once you have that understanding of global health and also global oral health, now you're starting to see where to make connections. So that's your aha moment, eureka moment. And that was maternal child health for me, to integrate oral health into existing maternal child health system and care. And it was quite beautiful. I felt like I found my the best ever imagined job doing maternal child health and exercise my specialties in dentistry. That's my advice.
Fantastic. Great. And I mean, obviously, we should have said from the beginning that obviously on World Oral Health Day, we're trying to kind of engage and participate with different folks and different partners, and that's why, you know, it's so great to have Hopkins Center for Global Health here. For the next Slido, we have a question about what do you think the barriers are for global oral health equity? And so sometime like last two, this one and last, we would see your desktop, but not the Slido. But I think if you're doing this on a different screen or on your phone, it's coming up.
Is this, can you see it now?
Yeah. And if you
Okay.
just want to see the speakers up at the top of your Zoom screen, you can just click meeting if you don't want to see the Slido. But here's this question: what is the most significant barrier to global oral health equity? And you have a couple of choices. Perfect. So as that goes through, we'll see how things go. And then for our panelists, so current challenges in global health. So let's talk a little bit about this funding crisis and the impacts to global health, the research and public health initiatives. Let's tackle that one first. And Dr. Seymour, do you want to take that one?
Sure. It's yeah, it's interesting. I'm watching the responses come in and that people are identifying funding and financial resources as the most significant barrier, which I certainly can understand and relate to that. I will respectfully push back a bit on that and say that it takes political will and prioritization to identify and devote resources. So my selection was policy and government. And just speaking from my own lens, my own experience, something that I've learned in global health, we're hardy. It takes a lot to keep us down because we are always working in resource scarce environments. This is what we adapt and still accomplish work in those settings, not to at all diminish the current climate around funding, and that of course we need funding to do our work. But I will say, if you want to find anyone who has learned how to do important, impactful work with very little resources, look to global health for that. That defines us. And so I would say, you know, when resources shift, when we thought we had resources and then we don't, find that courage to pivot. It's not the money that is generating the innovation, it is the people. Our people are our greatest asset. My mentor, Dr. Richard Cash, Professor Cash, a physician at the School of Public Health, passed away recently after a long career in global health, and he was best known for his invention of oral rehydration solution, which is a really simple, affordable innovation of water, sugar, salt to combat one of the greatest childhood killers, diarrheal disease. And never sold it for a patent, always believed in offering it so that it remained affordable and accessible. And by the end of his career, he was credited with saving about 80 million lives. that's impact. And his innovation, came from very little resources. So it's just a reminder of what is possible when we remind ourselves that it's people that drive change. Yes, we need resources, but it doesn't have to mean large amounts of them. We have one another, and I have, for every story like Professor Cash, I have so many others, and I'm sure my colleagues do as well.
That's amazing. You're like the public health whisperer. I mean, that's the kind of inspiration a lot of us probably needed to hear a couple months ago.
Yeah.
And probably on a daily basis, because it's just been so disheartening as far as grants being frozen and this and that and all the chaos. But so then Dr. Lee, kind of in a similar vein, yeah, what's the kind of next steps for you?
I 100% agree with what Brittany said. We're dentists. If someone gave us a paperclip, we will make something out of it. So we know how to figure things out. However, while I'm away from United States for a couple of years now, watching what's happening there and anywhere in the world, it was very, very difficult to watch. I just came back from rural Kenya. The USAID funding and all those things that we are witnessing now, that impact was really palpable in the field. The whole team is just disappearing because of what's happening now. So I agree that we need champion leaders and political will to make things happen, which will generate RFP and those funding sources. Now, it'll take some time, 4 years. Meanwhile, what we can do, I was looking for other opportunities, and that's one of the reasons I moved here to South Korea, to learn about opportunities here and also network. And it was very interesting. So I recently got the South Korean government development fund, not research grant, not dental grant, but it's a developmental grant. So it was the first time in history for the Ministry of Foreign Affairs South Korea to give this grant for dental project to train workforce, nurses and midwives to do maternal and child oral health in rural Kenya. But they've been doing this all along, building schools and hospitals and universities. But dentistry was not the topic that they were looking for specifically, but we fit our proposal into their RFP, and we fortunately won the grant. There are other opportunities because my area is maternal and child health. That's what I'm looking for. The Melinda Gates Foundation recently released a grant opportunity end of last year. It's called Pivotal, and it was a grant opportunity to elevate women's health. So our team prepared a proposal and applied for it because we can position oral health as a women's health, and we can create that as a project direction as well as research direction. So in this time of lots of uncertainties and shortening of funding, NIH grant and FOGATI and all those traditional grants may not be easily accessible at this point, but we can be creative, go beyond dental and even go beyond health and looking for grant opportunity and foundation opportunity that we can work together. I think that will be really key to survive and thrive next few years.
Yeah, agreed. Thank you. Thank you. I think there's a lot of excitement from other parts of the world, especially from Global North perspective. There are other regions of the world that either they're kind of looking at it and saying that, sort of watching the car crash happen and realizing that, those other countries need to step up. that there is an opportunity. I also feel with my narrow field that I've chatted with in Southeast Asia and in Africa that there's this sort of realization that, well, we obviously need to step up, and it's a bit of an opportunity to kind of change the tide. We'll turn it back to the audience as far as another Slido question. And this is about what aspect of global oral health interests you the most. And as we get that going, and if you're having any Slido challenges and such and want to participate, you can feel free to put it in the chat as well. And for our panelists, yeah, okay, good. That looks good. And it comes up on the phone. Yeah. Oh, good. It's moving. Perfect. Okay. So for our guests here, are we all just burnt out, or will it get worse? There's a lot of talk about burnout and anxiety, and Dr. Seymour kind of challenges us that, that's kind of part of public health, but this does seem a little bit more than usual. But so, Dr. Seymour, are we in a rough patch, or are we heading to a crisis? Thoughts? You kind of addressed it a little bit, but
Yeah, we're in a rough patch. We need to say it out loud and give space for people to say, I'm sad. And I am sad, by the way. I may be trained in managing happiness, but this is hard. I think, there's been a lot of research coming out on burnout, particularly since the pandemic, which was a major trigger for that. I don't think as a society we're fully recovered yet. I will say, though, as human history has shown us, out of these lows come some of our best. From some of our worst moments in humanity, we developed the Declaration on Human Rights, human subjects research protections that have really changed the landscape. I think we're in another moment like that. We're seeing a lot of investment in mental health and flexible work and self-care and things that allow us, particularly in certain societies where work is prioritized, allow us to maybe rebalance the way we're living our lives. So in ways that we haven't seen before at scale. So, again, we're innovating, we're responding to this. I would say that, I think we're leaning into our human connection right now, identifying those shared values and the solidarity, the reminder that we are all in this together. I'm hearing from colleagues I haven't heard from in a long time, just reaching out and saying, what can we do? How do we get through this together? So back to that theme of the power of people.
yeah, very good. Yeah,
I
Dr. Lee,
really,
so any bright spots? What's going to help us stay
yeah,
motivated?
I really, really like the word solidarity, and I'm learning about it too. When I was younger, like 20s and 30s, when our team, encounter a wall, we pushed it hard, really hard, and keep pushing. And that was the way we worked to break the wall and make things happen, especially in the field and also the political will and all those and advocacies. But as I get older, wiser, more white hairs, I learned that there are other ways to go over the wall, not just break down, but we realized that there are other people to help on the other side of the wall. So how to make a passage, how to make doors together, that's something that I'm learning, literally learning now. So for those who pushed really hard and keep pushed and burned out, I hear you and I feel you. And I really want to emphasize that you're not alone and we're there. And maybe it's time, maybe we need some time to stay back and ask who else can I ask for help, and how can we make a team and the solidarity to push the common agenda forward. Maybe we need to be friends with someone that we were not friends before, or organization or entities outside dental, outside health. I think that could be a really key thing to do in addition to the funding. That kind of unusual, non-traditional network can possibly help us to burn out, to push this agenda of global oral health.
I want to add, I really appreciate what you're saying, Dr. Lee, and some of the comments. And just sit with this for a minute, continue this piece of the discussion, because it's where I think it's where so many of us are right now on this day. And I'm just thinking of, do we have anyone from Nigeria? I'm thinking of when early in my global health career, I was asked to join Dr. Phyllis Kenke, who was, hello, oh good, hi. Dr. Phyllis Kenke, who was working with organizations in Nigeria on HIV/AIDS research and some really incredible innovations and work happening there. And they didn't know anything about oral health and needed a dentist. And yours truly was invited to come and see how I might be able to support the oral health aspects of that work. And when I arrived, I noticed something that the colleagues at the institution where we were working would carry one another's handbags, purses, and that's we don't do that here at HSDM. We don't pick up each other's bags, and that might even be considered a little disconcerting if someone grabs your purse or your computer bag. So I noticed it and I observed it during my time there. And my sense as I just watched this is that was their way of supporting one another, saying, I've got you. I'm here for you. And my last day there, after a really important visit, of course, I learned more than I contributed, as always. I was walking to my car that was taking me to the airport, and one of them picked up my bag and carried it. And it was just a remarkable moment. I felt supported, accepted, and I have found myself going back to that moment a lot lately and just recognizing so many people are carrying my bag right now, and I am carrying others. And just when we're feeling this, the sober environment around us, look around for who's carrying our bags, because we are all doing it for one another. And it helps me to take that pause and recognize that.
That's amazing. That's very good. It's incredible how, different regions and different parts of the world, as far as the interaction, and you don't realize it and you don't, appreciate it until you either go back or visit for the first time. I think that's the beauty of any kind of global health collaboration, is that opportunity, whether it's a visit like Priyanka and I just recently did, or that's the beauty of conferences and meeting in person. The frustration of Zoom. So with this concern with maybe the global north losing its grip on global health leadership, we've seen some countries step up and lead their own initiatives. Are we finally seeing a shift away from reliance on global north funders? So Dr. Seymour, what does this mean for the future of global oral health? Do we need more innovation? Is there some sustainability issues that we need to kind of explore? What do you think?
I think this is a shift. I think it's the direction we should be going. I see this as an important evolution in the field of global health and global oral health that has been in the works for decades. There's been a push to decolonize global health. There are some moments that need to be acknowledged that were some of the precursors of global health that are not positive, that we are reconciling. So I think we're working toward a more equitable, balanced approach to what global health is. I think it's an indication of how we define leadership. I don't think leadership is I'm out in front, I'm first, I'm making the decisions. I think we're changing that definition from that perception of leadership perhaps to maybe partnership, opportunity for mutual partnership, collective decision-making, inclusive decision-making, asset-driven mindset, rather than this approach of deficiency mindset. So I see this as a promising development that we have been striving for and working for a long time.
Very good.
Mhm.
Again, that's the inspiring message that I could have used a couple months ago, but should have emailed you. I didn't realize you were so, I mean, I knew you were positive, but like I didn't know you had studied this and yeah, I mean, yeah, I should have known. Like I knew you were positive, but Dr. Lee, I've lost my notes. So great examples of Global South-led success stories.
There are many. Community health worker model, amazing model. Pharmacists, they are the backbone of primary healthcare in many low-income countries. They are the primary care doctors in many places. I may not answer directly your question, Sujay, but I want to share a story of an individual, not the global South, North, the whole region. I recently talked to this dentist. He's from global North country, and then he really wanted to serve the global South people. So what he did was amazing. So he went to dental school in global South to experience the dental education, and to understand the whole healthcare system. And that very dental school in Rwanda is the one that Brittany and Harvard Dental School built so many years ago. So he went to that school as a foreigner, graduated, and he started to build his dental hospital in Rwanda to serve the Rwandan communities. So to me, it was a blurry moment between global North and South. So it's not unidirectional flow of funding or resources from North to South, but it was whole dedication and time to serve the population that he wanted to serve, and he lived there, and he's still living there. So that was a whole paradigm shift for me. Like, oh wow, it's a co-leadership now, not South or North or a zero-sum game, but it's collective. And it really depends on the individual dedication and such contribution to global health and global oral health. So I'm not that hopeful person, but I was very hopeful after I learned about that story. So all that untold and unseen champions and stories, I think we're quite hopeful here.
That's exactly why I wanted you two here for this, is especially on this particular day to kind of lift us all up, because it's been a bit of a slog the past couple of weeks. So thank you. Now, so we still have a few more minutes. We're gonna get into our one of our last, well, no, maybe our final Slido question. Well, yeah, let's do it now. So if you could change one thing about global oral health, what would it be? So feel free to use the Slido or to pop it in the chat. And there it is. So only one word. That's quite limiting, quite restricting, Dr. Pri. So while those answers come through, I do want to briefly explain why I wanted you both here. Both Dr. Seymour and Dr. Lee were kind enough to participate in the first Global Oral Health Symposium at Hopkins, and I essentially cold called them, and they were both just so incredibly generous. They and individually they were the first. Dr. Lee was the first person that I was introduced to by faculty members. There are two in particular. So one, I'm thinking Dr. Lee was Dr. Marsteller, mentioned your name multiple times, and she's the one that I had posted about that have you met Dr. Lee? And I said, I've only read about her. Like, I don't like, can you introduce me and such? And I believe she sent an email introduction, and you were incredibly kind and generous and hopped on a Zoom multiple times with me and kind of guided me through some practicum and capstone ideas, and were very patient with me while I was working on a midlife crisis master's in public health. And so when it came time to find a maternal child health speaker, it was kind of a no-brainer. It had to be Dr. Hewan. And then similar kind of situation with Dr. Seymour. I was working on a social media campaign that failed, part of my resume of failures. But I reached out to a bunch of people from Boston, and the first person to write back was Dr. Seymour. And again, kind enough when I proposed this idea for a symposium, said, like, well, can you hop on a Zoom call? And within 3 days, we were chatting about this kind of half-baked dream I had. And so she had very kind of specific guiding questions that, like, have you thought about this? And what about, this other thing? And I was like, no, I didn't think about that. And so it truly just amazing guidance and lifting up from these two, and that. So they were the two kind of first people that I was able to lock in for this symposium, which we're having another version next week, but they can't come. So we're trying to figure out, like, how could we engage both Dr. Seymour and Dr. Lee? And so this was the half-baked idea that turned out not too bad. There's quite a few of you here. So thank you all for showing up, and certainly thank you to Dr. Brittany and Dr. Hewan for being here. I wanted to ask the audience if they have any burning questions, but before that, I do want to give an opportunity for, we'll start with you, Dr. Lee, as far as any kind of final parting thoughts as we approach the end of our hour.
Oh, I'm going to share my wish. That was your last question. What's my wish? So hopefully in my lifetime, I want oral health to be considered primary health care in any context. Elderly care, Leonie, elderly care, maternal child health, Katie, refugee health in crisis, all those different contexts, oral health is considered a primary healthcare. I think that would be amazing to see that. And I just saw the audience answer about the oral health and their wish awareness. Yes, we did a lot, and not we, WHO did a lot. The political movement, the momentum, good. And we have some resources to do actual program in the field. Great. But the brand and the perception about oral health from the general public, I think we are still far from it. And I don't think it's from us, academia and policy persons' job to do it. We need to learn from other world how to promote some value, appealing and attractive to the general public. So policy, program, advocacy, I think advocacy is something that we can really work on for next few years and a decade. How the general public will back us, will support us to rebrand oral health as a primary health care.
And Dr. Lee, I'm going to leave it to you for parting thoughts.
So I'm Yeah, I'm
Or
going
sorry,
to-
Dr. Seymour,
Yeah,
sorry.
that's okay. I thought that might be what you meant, although I think we could all listen to Dr. Lee all day. But I was just going through the chat and want to acknowledge what an engaged group this has been. This has been really uplifting for me. Thank you. I've been looking forward to it. I needed this too. Thank you for gathering us and for your vision for this session. Sujay, I'm grateful for it. I'll leave you with a couple of my favorite quotes that I've always loved during my career in global health. One is the Global Health Council's motto, there is no them, only us. I mean, isn't that what it comes down to? And then a quote that I always start my courses with every semester, from Rumi, that is, and you all may be familiar with this one. And there's a reason I'm sharing this right now. I'm responding to a couple of these questions. At first I was smart, so I wanted to change the world. Then I was wise, so I changed myself. That is probably what I've learned the most, continuously. And so thinking about the questions around how do we get oral health to be recognized? How do we get it integrated into the NCD agenda? I believe some of the successes have been because as a profession, as oral health specialists, I had to stop and say, how do we change our approach? How do we start to speak the language of our colleagues in global oral health who are not dentists? And that's what we did. We learned where their priorities were and how they were writing policy, and changed our approach. And that affected the changes that we have seen. The UN declarations recognizing oral health in 2011, the oral health resolution from the WHO in 2021. We started with ourselves. I'll say that as I've gone into leadership training, and engaged in executive coaching, how to be a more effective leader, guess where the focus was? On me. And that really is where change begins. It sounds cliche, but that has been where our successes have happened.
Yeah, fantastic. And yeah, this is exactly why I wanted you two on this webinar. So very much appreciate, and I think judging by the chat, I think the audience appreciates the positivity and the uplift with the message, because yeah, I think there's been some just dread and anxiety all the way around. I think one of the, again, the early career and some of the mid-career, because the opportunities just don't seem to always be there. I see some concerns as far as, the how and what kind of impact and that sort of thing. But I would recommend definitely the collaboration component. But are there any other? I think you both have been looking through the chat and addressed everything quite well.
I'm happy to kind of summarize the chat because there are a lot of thank yous for you, Dr. Lee and Dr. Seymour. Like if I read all of them, it's going to be another 15 minutes. So thank you so much. Very uplifting, very positive. There's a lot of people that have been echoing about health literacy, awareness, the demand to drive policy, competition into non-federal funding, with the political landscape certainly concerning a lot. NCD agenda, you kind of touched on that, Dr. Seymour. Broader global health education, again, community health workers, maternal and child health, everybody kind of echoing, but with just 4 minutes to go, I just wanted to ask these two questions, one for Dr. Seymour and one for Dr. Lee. For Dr. Lee, it's a pretty short, easy question to frame, but very difficult to answer. Dr. Lee, how to make oral health important?
That's an easy question. Okay. How to make oral health important?
While Dr. Lee is thinking, like I said,
Thank you.
I'm gonna ask Dr. Seymour or tell her question is, what has been the most significant challenge in getting oral health recognized at policy level?
The competing attention for so many other priorities. And the approach that has worked is let's all work together. It's not the us versus them, right? There is no them, it's only us, back to that call. So, you know, if we think of it as competing for resources, that's what it will be. If we think of it as shared approaches, and collective resources, then that's the direction we'll go. And the latter is where I've seen the success happening.
Yeah, thank you so much. Dr. Lee?
Yeah. All right. So I'm from Maryland, Baltimore. We all remember the unwanted driver. That tragic led to so many changes in policy and awareness and all that. But we don't need someone has to pass away to make those changes, great challenges. So I also tend to make oral health more serious, right? The association with a preterm birth, someone can die, can spread to brain and heart and all that. When I tried those tactics, it didn't really work well for me in my context. So then what? Now I'm learning, if the message is not from me, but from my patient, from the people, from the villagers, from the community, it's quite powerful. So I think it's my job for next few years to train my people, train my patients, and train my village people to understand the value and speak up from their own voice and create an environment how to amplify their voices. Then I think people will consider, people meaning collective us, will consider oral health important.
That's fantastic.
Wow,
And
I
what
couldn't
a-
have come up with that answer in 20 seconds.
Yeah,
Amazing.
no kidding.
Thank you.
So we are right at the top of the hour. I just want to thank everybody for attending, especially Dr. Brittany Seymour, Dr. Hyewan Lee. Thank you so much for attending, especially kind of this last minute spur of the moment idea to celebrate World Oral Health Day. Thank you to Megan Harrison from the Center for Global Health for organizing all of this and the technical aspects. And thank you, Dr. Priyanka Gutsarkar from Solidarity Dental for organizing the Slido. And thank you all for attending. I think Megan has put in the chat the information for next week's conference. We're sold out in person, which is very exciting, but we do have room in the Zoom room, so please consider attending. And the agenda will be updated, I think, this afternoon, because we've had some band speakers, so we've had some movement. Yes.